The webinar objective, number one, to discuss of vaccines and vaccination to reduce under 5 mortality and save lives. And the second objective is to spotlight the pneumococcal conjugate, because we know that November is World Pneumonia Day, November 11th, and we have celebrated it. This is also part of the World Pneumonia Day celebrations. And the last objective, but not the least, is also to spotlight or to highlight CSOs supporting the government in their various ways to accelerate the introduction of pneumococcal conjugate vaccine and the rotavirus vaccine in South Sudan and also in Guinea. So now I am happy to hand over the floor to my boss, Chika Kemi, of CEO and founder of the Vaccine Network for Disease Control. Ma, the floor is yours.
Hello, everyone. I hope you can hear me. Can you hear me? Can you hear me?
Very well.
Good afternoon, Mom. We can hear you.
Okay. Good morning, everyone. I'm so happy that we're here today, because first and foremost, for me, it's a really fantastic thing for me, because we have 3 countries in one room, 3 African countries collaborating for the life of the Nigerian child. We are collaborating because of immunization. We are collaborating because we love the work that we do and want to contribute to saving all our children, both in Nigeria, in South Sudan, and in Guinea. So for me, it's a very, very exciting, engagement. So today is going to be the first of a series of webinars that is going to be looking at country's perspective. We're going to be learning a lot. Look at Nigeria. What did Nigeria do when they introduced the rotavirus vaccine and the pneumococcal vaccine? What did they do that was not so good so that other countries don't copy it? How do we collaborate together to make sure that our sister countries, South Sudan and Guinea, also introduce pneumococcal vaccine and then the rotavirus vaccine into their routine programming to save the lives of our children, and then we know that, for instance, Guinea is finding it difficult to raise the money for this vaccine, and South Sudan has somehow kind of launched, but still funding is an issue. How do we go about it as CSOs? This is a CSO-driven engagement with our French sisters and brothers and also our South Sudanese sisters and brothers. So let's hit it. Let us listen to what we need to listen to. Let us learn from one another. Let us collaborate. Let us do everything that we need to do. And at the end of the day, where is South Sudan in this space? Where is Guinea? What are CSOs doing? What more can CSOs do? How do we need to help one another? How does Nigeria support? How does Guinea support? How do we support South Sudan and Guinea? How do we, all of us, collaborate? Because we have done the first engagement in Nigeria. This is going to be the second one, and there'll be many more. So this is the beginning. It's an innovation that is coming up for us to deeply contribute to the introduction of rotavirus vaccine and pneumococcal vaccine. So I'm saying that we should look at it as a family meeting, so where we can come out and say, we have somebody like Dr. Bakunawa here who was very critical for the introduction. We have so many people here who are critical. Let's hear what they have to say. Let's listen, let's hear. Let's now start to implement and support government efforts to make sure that these vaccines get to the countries. And let's not forget media. How do we use media? All these things will come to the fore. The technical aspect, the media aspect, the CSO aspect, the community engagement aspect, demand creation aspect. I'm very excited today, I must tell you, because bringing all of us together is what I've always wanted to do. So I want to say, let's go there, have fun, do the needful, learn, get the recommendations, and continue to hit the ground running and continue to save lives on this project, which is called the Precise Project. And we're going to do all the things we need to do precisely. Thank you very much, and go ahead. Thank you very, very much. I'm very happy to be here. Thank you. Chika,
Thank
please
you very much.
Take the floor.
Doing what you love. Thank you very much, Ma. And I would like also to invite Dr. Clarice. She is with experience in managing childhood diseases And she's a CSO, and she has expertise working across low, middle, high resource environment. And in this project, in our precise project, she's the CSO consultant working with us on this introduction with the CSOs in Guinea. Dr. Clarice, you're welcome.
Thank you, Shika, and to Shika for the dynamic introduction. Thanks to Vaccine Network for hosting us in Abuja, such a critical time for the two CSOs of Guinea, FEGED and Rajgi, and also for the South Sudan CSOs. It was a fantastic time and a real peer learning time, and which is really important. In fact, I really believe, and we all really believe, that the change will come from our communities, and our communities need to be really educated, to be informed, and this can also can only be done properly by other CSOs. So thank you for the Vaccine Network to have been such big brothers for those CSOs. Merci à tous les francophones qui sont là. Je suis Clarisse Loeloumou, j'accompagne la Guinée et les organisations de la société civile guinéenne dans ce projet. Et nous allons bénéficier, Vrajgi et FEGED vont bénéficier de l'expérience de Vaccine Network for Disease Control, qui a déjà participé aux côtés du gouvernement nigérien à l'introduction des vaccins PCV et rotavirus, et sont en train de transférer leur savoir-faire à la Guinée et au Sud-Soudan, qui n'ont pas encore introduit. L'idée est vraiment qu'on partage les expériences et qu'on puisse chacun apprendre les uns des autres avec nos propres paradigmes et nos propres paramètres. Je vais maintenant passer la parole. Shika, I'm going to hand over to Abdoulaye, who is from the Rajgi CSO in Guinea. We have two CSOs in Guinea, Rajgi and FEGED. And Abdoulaye is going to speak on the name of the two CSO to quickly explain what they have learned and what they have, how they are being mentored by a Vaccine Network. And thanks for that question. Abdoulaye?
Hello, Abdoulaye, are you on the call? Hello.
If Abdoulaye is not ready, Usenatu is on the call, and Usenatu is our consultant, is our communicant person in that precise project. Sorry?
No, I say yes, she's the media officer.
OK, so Usenatu is the media officer. Usenatu est la communicante pour ce projet. Usenatu, est-ce que tu veux bien intervenir et expliquer comment est-ce que tu utilises les outils de communication pour faire avancer ce projet? OK?
Oh, OK.
Allô?
Yes. Okay, thank you very much.
Abdoulaye, est-ce que tu es disponible? On passe la parole à Usenatu, s'il te plaît.
Oui, la connexion me fatigue un peu, je ne sais pas bien ce que vous dites. Vous pouvez passer la parole à Usenatu, après je reviens. La connexion est bonne maintenant.
OK, est-ce que tu es prêt à intervenir?
Oui.
OK, d'accord. Bon. On t'écoute alors, Abdoulaye.
OK. Bonjour à tous et à toutes. Merci beaucoup pour cette rencontre. Voilà, en Guinée, le Rajgi, en consortium avec FEGED, nous avons commencé à mener des activités du projet Precise après notre retour du Nigeria. Et nous avons commencé par les rencontres des plaidoyers, les prises de contact avec les autorités administratives et locales des localités cibles, mais aussi les autorités nationales, notamment le comité CZTV, ensuite le PEV, le ministère de la Santé, et les DPS, les DRS, qui ont vraiment adhéré à ce projet de, de préparation, disons, à l'introduction des vaccins PCV et rotavirus en Guinée. Et déjà, les autorités nous ont fait comprendre, évidemment, que la Guinée est engagée dans le processus et cette année, ça devrait avoir vraiment eu lieu, mais voilà, pour raison de d'autres virus qui étaient vraiment plus pressants, ils ont reporté pour décembre, au plus tard décembre 2025. Donc, il y a même à date un consultant qui a été identifié par, c'est pas Gavi AFS, ce qu'on appelle UNICEF, qui travaille sur la politique d'introduction de vaccins. Donc, c'est-à-dire que vraiment les préparatifs ont commencé au niveau des autorités gouvernementales. Ensuite, nous avons rencontré 48 agents de santé dans les deux districts sanitaires, disons de Kindia et de Koya, qui ont été sensibilisés. On a commencé à les sensibiliser sur les bienfaits du vaccin, mais aussi les informer, les informer des modes d'administration du vaccin et tout, mais aussi les inviter à sensibiliser les citoyens à la base pour adhérer à cette vaccination une fois que le vaccin sera introduit dans le calendrier national de la vaccination. Donc, c'est vraiment une activité qui a été saluée. Et ensuite, nous avons mené une enquête sur les attitudes des agents de santé. Et là, sur l'ensemble des agents de santé de nos deux districts sanitaires, nous avons également interrogé 48. Et là, les résultats de cette enquête se trouvent dans notre rapport technique que nous avons transmis à Network, à Vaccine Network. Voilà, et en gros, ce que je peux dire en attendant. Merci beaucoup.
Merci. Thank you, Abdoulaye. Thank you for this update. Merci beaucoup, Abdoulaye, pour cette mise à jour. So we have just learned that 48 health workers have been educated, informed on the introduction of the PCV and the rotavirus. And that is fantastic because we are already been preparing the country to introduce the vaccine and the frontline worker to introduce the vaccine. Usenato, can you please tell us how you are using your communication tools to communicate and to advocate for the introduction of PCV and rotavirus? Just reminding here that PCV, pneumonia and rotavirus are the first and fourth killers of children in the country, in Guinea. Donc, Usenato, est-ce que tu peux juste rapidement nous dire comment est-ce que tu utilises tes outils de communication pour aider et soutenir le plaidoyer pour l'introduction du vaccin en Guinée. Bonjour, Usenatou. Usenatou, tu es connecté. Usenatou is mute. Is she mute or? Usenatou, est-ce que tu es mute? On ne t'entend pas, tu es en silencieux.
La connexion n'est pas bien au pays.
Abdoulaye, il faut te mettre en silencieux, s'il te plaît. Okay, so this is one of the challenges that our CSOs have on the field, as you can see. Ça, c'est un de nos gros défis. Tu es là, Usenatou? Usenatou est donc oui, elle est là, elle est présente, mais je pense qu'elle a un souci de connexion. Donc, Usenatou est donc la communicante du projet Precise. Elle a permis de rendre visibles les actions que Abdoulaye vient de vous énumérer, la rencontre avec les différents acteurs locaux, gouvernementaux locaux pour la vaccination. Elle a permis de vulgariser l'atelier et les sessions de formation et d'éducation des 48 agents de santé qui ont été formés et sensibilisés à l'introduction du vaccin contre la pneumonie et du vaccin contre le rotavirus. Ousenatou a également mis sur pied un site internet qui est spécialement dédié au projet Precise Guinée, elle va mettre le lien dans le chat. Comme vous voyez, beaucoup de mal à travailler parce qu'aujourd'hui, c'est difficile de travailler sans une connexion qui fonctionne correctement. Et là, vous avez un exemple en, Guinée, en direct. OK. Elle va nous mettre dans le lien. Peut-être que tout à l'heure, on va revenir vers elle. So, Senator could not speak because the internet is a real challenge in Guinea. But she has been the one who has highlight and showcase what was happening, what Abla had just explained about reaching out the different authorities, all the actors around immunization and the principal decision makers for the introduction of PCV and rotavirus in the country. She has also set up a Facebook website for the project, and we are going to put the link in the chat. So up to you, Shika. Thank you for this update on the part Guinea is taking in this precise project. Thank you.
Thank you very much, Ma. And I listened in the interpretation, and I'm very glad. I'm happy with what I heard and how they have gone to the work they have done so far in Guinea. I'm proud of you, Delight. Thank you very much. And then Afanta and Hosanatu. Thank you very much. The next on the line will be a presentation by a conversation, his remarks from Dr. Robert Napoleon, the NITAG chair at South Sudan. I don't know if he has joined. I was trying to look for him here. Dr. Jolem, do you know if he's here? Calling on Dr. Robert.
He was in by then he left. So
maybe you can now just give your own. Yes, you can give your own country perspective and CSO engagement activities in South Sudan, and then talk a little bit about your organization. We have 3 minutes.
Okay. Thank you so much for the invitation and also giving us the opportunity to share the South Sudan perspective on CSO engagement. Good evening, everyone, and good morning if there are those who are in the morning time. My name is Dr. Jure Manje, and I'm the country director for Impact Health Organization. It's an NGO based in South Sudan. We realize that the Precise project is really a significant step for us as a civil society organization in South Sudan to advance childhood immunization activities, especially on the introduction of rotavirus and pneumonia vaccine in South Sudan. And we see that vaccination is one of the cornerstone effort to reduce child mortality in South Sudan. And we really want to appreciate the government of South Sudan and also the civil society organization for the work they are doing. As so far, South Sudan has already put forward the steps and also has been involved in the process of the introduction of the new 2 vaccines. And as per the standing, South Sudan intends to introduce the vaccines next year. And currently, we are working closely with the National Ministry of Health and also some key civil society organizations to see that before the introduction, we are able to meet all the requirements that will help us to enroll the vaccines in the communities. However, you realize that civil society organization in South Sudan, we are currently challenged in terms of mobilization. We realize that there are very few CSOs in the platform which are currently advocating for the introduction of the for the 2 vaccines. And however, this project gives us an opportunity to engage with them, those who are not yet, so that they can join the platform and build on it together with other stakeholders to see that we advocate for the introduction, but also support the process of the introduction. When you look at the issue that's surrounding vaccine introduction, we can't do away with vaccine hesitancy. And this is where we see there is a significant barrier to access or to see the success of immunization programs. And we feel that there is need to be done in terms of increasing access to information and also deal with the spread of misinformation and rumors. And this is where the civil society organization comes into play. Currently, we have already started activities which are related to engagement with communities. For example, through our organization, we have participated in the introduction of malaria vaccine in one of the county, and we've already seen the challenges that comes with the process of introduction, which looks at the misinformation, providing accurate information to the communities who play a big role also in the introduction of the two vaccines. And here also we are looking at using innovative ideas like social media to engage and create awarenesses. Some of the things we are looking at is identifying, analyzing information to understand the kind of misinformation that would come along with the vaccine, and then also provide tailored messages that would provide clear and concise, culturally sensitive, to debunk any myth and also address the concerns effectively. But also we feel that collaborating with local leaders or local influencers, trusted leaders who have a strong understanding of the community perspectives would provide us a benchmark for us to engage. We also feel that in terms of creating information, we should look into the issues of infographics, videos, and maybe sharing personal stories, especially for those who are already, at the time of the introduction, already taken the vaccine, so that they can give a proper information on how they've been able to access the vaccines. But also we have already started to work with the media. So far we have already published in 3 media houses to talk about the introduction. We have also held a TV show, which was also talking about the introduction of the 2 vaccines. And also we have already started engaging in our social media platforms, using the hash handles that can help us to continue pushing out information on the introduction of the vaccines. Currently, we are working with the National Ministry of Health to mobilize a stakeholder meeting, which involves us to work into the process of increasing resources for immunization. We are not only looking at the introduction of the pneumonia and rota, but we are looking ahead for sustainability processes. So we have already scheduled it to take place around 28th of this month, and we are working closely to see that we bring together the key stakeholders that will help us to push this forward, considering that South Sudan currently its health budget is underfunded, and we feel that there is more need to work together, the civil society and the key stakeholders, to increase the national healthcare budget and also the immunization budget. In my conclusion, I can say that we effectively address the issue of vaccine hesitancy and also create a platform for the introduction and also the resource. It is good for us to have enough information and knowledge to engage with other civil society organizations, government agencies, and other stakeholders to see that immunization is a vital program in the country to reduce child mortality. But also we feel that civil society have a role to play and to build on the confidence and supporting immunization efforts in South Sudan. So looking forward to accurate information and community engagement and collaborative actions would really create a crucial platform to address the challenges that will come along with the introduction of the vaccines. Thank you so much. Over to you.
Thank you, Dr. Jolene. You were given 3 minutes and you used things. Thank you very much. So going forward, I would just like to remind us attendance is on the attendance, and then interpretation services are available. You just see interpretation if you're using your system, or you can click on the 3-dot link for more and choose the language of friends. And so for Dr. Garuba Bakunawa to give a presentation. Let me share. Dr. is a dedicated public health professional. He serves as the principal medical officer at the National Primary Health Care Development Agency in Nigeria. And he has it on improving Nigeria's healthcare system. And he is already a member of the secretariat at the at CDA, Secretariat for 9. So I will invite you now to kindly share your screen, Doc.
Thank you, Chika, for the
Yes.
invitation and also giving me the opportunity to take this presentation on the role of the vaccination in safeguarding the health. So I'll project my screen so that I'll take the presentation. And just like we all agree, this presentation is also going to be like more or less a discussion because for us really to align properly, so we have to make it a little bit flexible so that it will be contributory. So we'll be looking at what are those challenges as well as also the experience that is needed to have a successful introduction of vaccines. So we'll be starting from the basics, then we now move forward. Thank you very much. Let me share my screen. I think I am co-host. Okay, thank you very much. Let me share my screen now.
Okay. Oh, okay. Hello, Doc. Are you still there? We are here to see the screen. Hello? Hello, Dr. Bakuna, are you still there? Cannot hear me.
Hello, please, can you see my screen? Sorry. This our network is terrible today. Can you see my screen?
Not yet.
Not yet? Okay.
Should I share the presentation I have? Okay, I think it's coming up.
Let me try now. It's coming up, Abby.
Not yet.
Not yet again? Okay. No problem. It will come up now. Okay, fine. I think it will come up now. Hello, can you see my screen now?
Yes, it's up.
Okay, thank you very much. Okay, so thank you very much. Thanks for again giving me another opportunity to have this conversation with our colleagues, with a common goal, with our colleagues from our neighbors here, other African countries. So actually, the topic is around the preventing pneumococcal infections. What is the critical role of vaccination in safeguarding the the health. So as based on this, but the conversation will also rally around what really do we need. So as a country, for us to really introduce the new vaccine, there are a lot of critical things that we need to have in place, and for us to have a very successful introduction. Of course, by now we already have our approvals, and some may have already introduced, while others are in the just about to introduce. So what we need to have is to ensure that we have that strong team. We have that strong team that can support a successful introduction of vaccine in those countries. So, so the overview, the outline of this presentation is going to look at the pneumococcal vaccines, the target group and mechanism of action of those vaccine, benefit and specific protection, importance and impact of PCV vaccination, the role of vaccination in safeguarding the health, the importance and key achievement and initiative that we have that can serve as a lessons for the countries that are about to also introduce vaccine, pneumococcal vaccine, rota vaccine, and any other vaccine. So we are just taking pneumococcal vaccine as a proxy to have this conversation. Then what are the challenges that usually we face? And we look at some few references that we use in coming up with this presentation. Just as a background, so the pneumococcal vaccines are a type of vaccine that are designed to protect against infections caused by pneumococcal pneumoniae or streptococcus pneumoniae, also known as pneumococcus. So that's the organism that is responsible. And the vaccine, we have different types of vaccine, as we can see. So however, the commonest of them, those are the two we have. So we have the PCV vaccine. So we started with the PCV because this is the commonest one that we use. So we have the this is recommended for children under the age of 5 and also adult over the age of 65 years. So those are some of the specific. And I think presently, as a country, the one we use is PCV10, which is referred to as this Synfloris. So the other types that we also have is the pneumococcal polysaccharide vaccine. So the conjugate vaccine is the one we use commonly, but we also have the pneumococcal polysaccharide vaccine, which is recommended generally, usually for the adult over the age of this. So in terms of some of the infection that this disease really prevent are the pneumonia, which is the commonest, especially in the under 5. So, which is an infection that usually affects the lungs. Then we also have the meningitis, which is also can affect the brain and the spinal cord or the meninges. Then we have also one of the commonest also component is the blood infection, which is referred to as sepsis. So sepsis, especially for the under 1 and neonate, is one of the commonest. And also this kind of organism, they are actually responsible for a lot of cases of mortalities or sepsis related to that. Then we also have the other diseases that are also common related to this organism that are also vaccine preventable. We have the otitis media, as well as also we have some of the infection of the sinuses. So in the next few slides, we'll be able to see what are those things, critical things. So in terms of the target group, of course, under 5, for routine immunization that we are currently discussing, so for routine immunization, we are looking at depending on the decision by the countries. So for us as in Nigeria, so we are looking at the pneumococcal vaccine. Presently is in the routine immunization, and the target age group that are benefiting from it are those within the 0 to 23 months. However, presently, based on the current intervention that we are doing around big catch-up, which is expanding the routine immunization age group. So we have expanded, or we have, moved the target age group to also 24 to 50, 55, 59 years, which is just under 5 as described here. We have adults, especially in some other countries. So I don't know in the case of Guinea-Bissau and other countries that are here with us. So I believe that some countries prioritize. It depends on the priority that you have, whether you do also adult vaccination for pneumococcal vaccine and others. So for what we have currently in Nigeria, unless in the private sector, but we don't have that pneumonia deployed in the routine system. Then we have also other high-risk groups. For the country also, there were a lot of discussion at the NITAC, and that's Nigeria Immunization Technical Advisory Group. And the focus will be like, can we also consider other high-risk groups? What are those high-risk groups? We have, the first one is those that have sickle cell disease. We know that those that have sickle cell disease, they have tendency to come with a lot of those infections related to pneumonia, and as well as also adult. So for adult with weakened immune system, especially those with cancer, and also those with some infection like HIV/AIDS, they have tendency to come with that. So people with also chronic lung disease, heart disease, as well as liver diseases, they have tendency to come with a depressed immune system, and they have tendency to have infection by those organisms. So all those ones, they are potential target group for the vaccine. So I don't know what you have as part of the overall conversation. In your country, I don't know what was the recommendation that you have, whether it's only for the under 5 or the children, or you are also extending to other categories like those high risk, and also for the adult. So I try to expand this because we are not discussing only the context of Nigeria, but rather looking at generally the whole spectrum of what are those potential areas. So in terms of the mechanism of action, I'm not wasting time because primarily it's just to look at some of those role of the vaccine in safeguarding the health. However, it is also very important for us to know why we bring all those in generally as a reminder is because of the fact that the mechanism of action is really critical in addressing some of the challenges that we have around new vaccine introduction. The major challenge we have is around vaccine hesitancy. And the vaccine hesitancy is always good as you are developing your materials for the new vaccine introduction. For the pneumococcal conjugate vaccine as well as rotavirus vaccine, it's very important that you have a very good training for your healthcare workers, and part of the training is around also the communication, as well as what we refer to as risk communication. So for you to have a very successful introduction of the vaccine, you need to really make sure that you train your healthcare workers on what we refer to as risk communication. And you cannot have a very good risk communication without having an idea on the mechanism of the action of those vaccines. So the mechanism of the action of those vaccines help in addressing a lot of concern from the communities, because they usually ask a lot of questions about, they go to an extent to ask, how does the vaccine works? So if you are not really prepared for that, by the time you come to deliver your commodities, and just somebody from community is asking you questions, just basic questions around the mechanism of action, or asking you some information about the vaccine that you cannot provide, that's the end. That person will not have confidence in really accepting your product that you bring. So it is very important that we ensure that we have an idea around how those vaccines really protect children from infection through several mechanisms. And some of the key mechanisms are those. We have those that are mediated through immune response, which has to do with the antibody production. So vaccines stimulate the body to produce antibodies that really recognize the culprit, that's the organism, and thereby really providing the attacking it, engulfing it, or at the same time, maybe trying to make sure that that doesn't cause disease. Then the other aspect is the cellular immune system, which we have the B cell and the T cells. So those cells are really very critical around the overall response of the immune system. So to eliminate the infected cell. So whenever we have an infected cell by those organisms, so that's where the T cell and B cell also provide those mechanisms to ensure that those infected cells are really eliminated. Then the other mechanism of action is actually to prevent the bacterial attachment. And this is also, as we know, around this antigen-antibody complex that is usually formed to mediate those interventions that may result in some of the symptoms that we see. So we have antibodies prevent pneumococcal bacteria from attaching to the invading cell. So the idea is like, if you have an antibody, the antibody also serves as an impetus in terms of attaching to some of the active sites of the embedded cell, so that this now will prevent the pneumococcal bacteria from attaching on those particular active sites, thereby preventing it from really going into the second stages of those causing those symptoms that we see. Then it can also have a neutralizing toxins, and it can also have a phagocytosis effect, where the vaccine enhance the ability of the immune cell to engulf and also destroy the pneumococcal bacteria. So in terms of what are the benefits of those specific protection? The benefit, number one, is also to reduce the risk of the invasion of the pneumococcal disease. Hello, are we together?
Yes, continue, sir.
Okay, so number one is to reduce the risk of the development of the invasive pneumococcal disease, that's the IPDs. Or the second one is also reduce the hospitalization due to pneumonia and the meningitis, those diseases. In the case of rota, it also reduce the hospitalization by the diarrheal disease caused by the rotavirus. It also reduce the risk of hearing loss as part of the overall complication, because the pneumococcal infection can result to otitis. Pneumococcal can result to otitis media, just like the earlier mentioned, and this can also result to hearing loss. Protection also against antibiotic resistant strain. So by the time you have a vaccine can reduce the chances of having the infection. By the time a child didn't have the infection, there is no need for the child to take the vaccine. And at the same time, it will also reduce the prevalence of the disease, and at the same time, use of the antibiotics, which can reduce the potential chances of antibacterial resistance. So age-specific protection. So in terms of this, we have infant 0 to 12 months. So for PCV, it prevents them from just like we have invasive disease and pneumococcal disease, as well as the other lungs infection. Then we have also toddlers 1 to 2 years. So we have also PCV protect them against otitis media and also pneumonia. Then we have preschoolers like 3 to 5. PCV maintain the protection against the invasive disease as well as pneumonia. Why are we mentioning this? Because this also helps you around some countries. In the case of Nigeria, like for the PCV and rota, we have 3 doses that we use now. And those 3 doses are given between the age of 6 weeks up to the 14 weeks. So, however, some countries, they have a separate schedule. Some countries give 2, some countries give 3, some countries even go to an extent of giving more than that, up to like 4, so that they have also a booster dose. So it depends on the analysis that you do and also the prevalence of the disease. So your own regulatory, the NITAG, is their responsibility also to have all those analysis based on the disease burden in the country and also the age prevalence. Now give a kind of opportunity for the country to decide how many doses are needed and at what of the ages those doses are really provided. But it is very important for us also to know as some of those age of protection as well as also the benefit. So why are we giving? A mother can ask you, why do we give 0 to 12 months? Why after like giving 1 year, are we also giving this vaccine? Or why do we need an additional dose? After all, my child is already healthy and also moving around going to school. So with all those one, if you have those information, those will also help you in terms of engaging them around addressing the vaccine hesitancy or the potential hesitancy. So, so we are going into some of the key integrities of this presentation, looking at the role of vaccination in safeguarding the health. So, vaccination, they have very important critical roles, and I have 2 slides to provide this particular role before we can look at some of the other components of the disease. So the first one is preventing infectious disease. This is more or less a kind of like a kind of repetition. For instance, reducing the risk of contracting vaccine-preventable diseases such as like measles, influenza, pneumococcal infection, rotaviral diarrheal disease, protecting against serious complication. By the time you have vaccine, the chances of complication is also reduced. Like meningitis can cause convulsion, can cause even can cause hearing loss. It can cause also a kind of in terms of the complication of the meningitis, it can cause even loss of sight. So sepsis can be very dangerous, can cause septicemia, which can lead to death. Then prevention of long-term health consequences. What are other long-term health consequences? That's overall as a sequelae to the those diseases. It can lead to hearing loss, brain damage, and others. So that's the first one. So infection prevention is one of the critical, role of vaccination in safeguarding the health of the nation, the health of an individual. Then the second component is protecting vulnerable population. Who are those vulnerable populations? Of course, the newborn, the infant. Then we have older age group, immunocompromised, as well as also pregnant mothers. So vaccination is very, very important in protecting them against those diseases. So protecting those populations from those diseases. Then the third one is also maintaining the herd immunity. Herd immunity is actually the population immunity. So by the time we have good VCR, that's vaccine coverage. So of course, that could help us to develop what we refer to as population immunity or herd immunity. So that population immunity is very, very important. Whatever we are doing in improving vaccine coverage, the target is actually to attain herd immunity. By the time you have herd immunity, maybe a coverage of 85, 90, 95%. So those are critical. You see, like, even those people that are not really vaccinated, because of the saturation of the system in terms of the coverage, that will also help in protecting others. So herd immunity is very important. And the role of herd immunity is actually in preventing disease transmission. So there won't be transmission because of herd immunity. Protecting unvaccinated individuals. So those that are not vaccinated, see, just like I said, herd immunity, when it is built, it also tends to protect them. Then reducing disease outbreak. So disease outbreak is also one of the major issues. So you will see a lot of outbreaks of vaccine preventable diseases. So you can see, like in Africa, most of the African countries, we actually notice a lot of outbreaks of diseases. However, when you have a herd immunity, all those ones may not be there. Then the other component is the reducing disease burden, so decreasing the hospitalization. So by the time you have a very good vaccination coverage in your country, so one of the things that the vaccine do or vaccination does is actually to decrease hospitalization. So you see, like, there is minimum number of hospitals. I could recall even before the introduction of HPV in the country, one problem that we face as a country is we have a lot of cases of diarrheal disease, which can also progress to a lot of blood fluid loss, dehydration, and death. So, however, by the time we introduce rotavirus, we have noted that there is a significant reduction in the hospitalization as a result of the diarrheal diseases. The same thing for pneumonia. Pneumonia tends to be a very, very common infection that every woman, if you say pneumonia, she can explain to you that what are the commonest cases, they will say pneumonia. So, by introduction of pneumonia and a vaccine, pneumococcal vaccine, as well as rotavirus vaccine, we have noticed a significant reduction in the hospitalization for pneumonia and diarrheal disease. And those pneumonia and diarrheal disease, they are one of the leading causes of under 5 or infant mortality in Nigeria and also in Africa and also globally. So the other component also is lowering mortality rate. By the time you have a low hospitalization, low disease burden, of course, there is low mortality as a result of vaccine preventable diseases. Then we also have reducing economic burden on healthcare system. Before, government spend a lot of money, households spend out of pocket expenditure around treatment of pneumonia, treatment of diarrhea. However, with the introduction of disease, reduction in the disease burden tend to also address those components. So people save a lot of money from all those hospitalizations. So the other component also protecting public health, so supporting global health security. So generally, when there is also good coverage of vaccination, it will also help in improving the security, health security. So generally, globally. So enhancing community immunity. So just like I said, the community immunity is something also similar to like herd immunity, then facilitating disease surveillance. Then also it also helps in terms of reduction in the burden in terms of surveillance. We also notice that there is also a lot of reduction in the surveillance of those cases. Then promote personal productivity and performance. So beyond all other things that we have discussed, one thing that is also critical in terms of the role of vaccination in safeguarding the health is to promote personal productivity and performance. How does the vaccine do that? A child or an individual that is well protected with the vaccine receive all its vaccine. So the chances is to reduce the risks of disease transmission. By the time it's reduced the disease transmission, one cannot be able to get those vaccines. Improve quality of life. So you see, like the quality of life of an individual will increase. There is decrease in the number of hospitalization, decrease the number of the attack by the diseases because of the preventive component of those vaccines. Therefore, this will increase the quality of life and also increase the life expectancy of an individual. A lot of kids also die within the age of 1 year, 2 years, under 5 because of the vaccine preventable diseases. So by the time you are a child is well protected, so there is tendency that child will also survive all those vaccine preventable diseases, thereby improving the life expectancy of those kids. Then the other aspect is the economic benefit, which is just like we say, reduce the healthcare cost. As also discussed above, they are under reduced economic burden and healthcare, improve the healthcare efficiency. We have also social benefit, which includes reduce abstinence from other important interventions, also important services or activities that one plan to do, improve productivity, just like I also put it there as part of the heading. So those are some of the important 6 components of the role of vaccination in safeguarding the health of the nation. What are the other important components? Some of them may be overlapping with what I have discussed. So these last 2-3 slides will be faster. So we have
importance. Yes, sir. We need to round up, sir. Thank you.
Okay. So this is just the important. Okay, maybe in 1 minute. So the importance and the impact. So we have seen also the impact in countries like Ghana, where 47% decline in the cases as well as of under 5 is seen within those age. In Nigeria, we have about 35% reduction in the pneumococcal infection. It's been reported in Mali about 40 to 80% reduction in the cases based on the coverage of the PCV. And we have also in Burkina Faso, those reduction were also noted. So some of the key achievements also is the reduction in child mortality, increase in vaccination coverage, as well as also some of the initiation that is currently there. We have like
réalisation clés et initiatives avancées.
Those are opportunities that are initiatives that are deployed through vaccination that can also help.
Réduction de la mortalité infantile en Afrique de l'Ouest.
We can see also in Mali and Burkina Faso. So what are the challenges? The major
On
challenges
a augmenté la couverture vaccinale et renforcement des systèmes de santé.
In Nigeria and other African countries,
et les défis.
Resource allocation has been also a challenge. And this is what also
les problèmes à surmonter sont le financement durable et allocation des ressources.
For immunization. I think you need to also grow from the good job
les OSI nous aident. Nous remercions les OSI parce que pour avoir le finance, pour avoir des ressources pour ça, c'est très.
So monitoring and evaluation of vaccine effectiveness has been a challenge. Integration with other programs has been a challenge. Vaccination hesitancy, like I earlier mentioned, has been a access barriers as well as also vaccine supply, not only to the country and also to the last mile to ensure that vaccines are there in the facilities for children to get. Very, very important. Then and also some of the major challenges about some of the emerging disease conditions like COVID-19 that we have noticed of recent and other things like malaria that is also coming up. You know, is vaccine preventable now. We have the vaccine. So those are some of the challenges. As an African country, what can we do to change the narrative? Those are some of the references. I want to thank you. Sorry, maybe I've taken more than the time that is given to me. Thank you very much, and over from my own. Thank you.
And thank you very much, Doc. And I love the passion as it is showing and everything. I hope if you have questions, please, you can put it on the chat box, and we'll get to that later. And also remember to fill the attendance form. The link is in the chat box. Also, for French-speaking countries, there is interpretation ongoing, although the network has been up and down due to Nigeria factor. It would be nice for us to also engage there. So I would take the last presentation, after which we could actually have maybe just a few minutes to ask a few questions. I plan not to keep us here more than 15 extra minutes. Please just bear with me. I'm sorry. I'm sorry about that. I can see people speaking French, speaking English, yes, and acknowledging the presentation that Dr. Bukunawa just gave. I don't know if Dr. George is available. Is Dr. George here? I could share my screen for the last presentation. Is Dr. George here? Okay, so Dr. George is the director in South Sudan at the National Ministry of Health, MOU, and he is in the expanded program. He's the expanded program on immunization director in South Sudan at the National Ministry of Health, Republic of South Sudan Directorate. I hope I got it right. Welcome, sir, and I could start sharing my screen for your presentation.
I just wanted to say that Dr. George is not in. He has not joined. Yeah. Try to reach. I don't know if it was the issue of the link. We tried to, but
okay, I know. Okay, present his presentation from South Sudan, or should I just go ahead? I already have the presentation, and he did, I believe. It's just a shame that we are not able to talk about it. Okay, let me just run through it. I am not Dr. George. I'm just
maybe Jolem or David can quickly run through the presentation since they are in.
yeah, sure. I think that's helpful.
Yeah, Shika seems to have a challenge with her connection.
Strongly the fact that there are a lot of concerns and misconceptions.
Shika, we are not hearing you. Vaccine Network, are you there? Hello.
I can hear you.
We're working on a network issue. We're connecting, please.
Okay.
Hello? Hello, can you hear me now? Hello?
Yeah, Chika, we can hear you. I was suggesting that Jolem and or David can quickly go through Dr. George's slide. And
okay, that would be
yeah. Can you have enough connection to it? Can quickly go through?
Yes, I'm trying to project it. Sorry, Dr. Jolem. Can you see the screen now?
It's coming.
Is it up? Hello?
No, ma.
It's coming, but
It's
not yet
coming.
there.
Hello, we're not getting you. They are not found.
Shika, you are projecting the last slide. Maybe you can come back to the first one.
Yes, I have come back to the first one. Sorry. And Grace, can you stop sharing? Let me share. At least my own sharing is. Okay. So this is where we are, I believe.
Yeah. David?
David, please take it up. Sorry about that. This is Nigeria. Nigeria is still an African country, so we have
It's going to remain an African country.
we have technical issues at times. So, okay, so by way of key definitions, we have vaccination, we have vaccine, we have immunity, herd immunity, as Dr. Bakuna had also pointed out, misinformation and then disinformation. Please, is David available to take it up so we do not extend it?
Yes, Chika, I'm available.
Okay, so take it.
Yeah, thank you so much. And I think I'm audible. So basically, of course, on behalf of Mr. George, who I think had issues with the internet and has not been able to join. Basically, our presentation is about addressing common concerns and misconceptions about vaccines. We know that misconceptions and concerns hinder acceptance of vaccines, and this is basically what we are going to be talking about. So, introduction, we will look at the importance of vaccines. Of course, the previous presenter talked about some of the importances. We are saying that they are most successful and cost-effective public health interventions, and they have drastically reduced the incidence of many infectious diseases, saving millions of lives. Global threat of vaccine hesitance has been an issue, and notwithstanding even a country like South Sudan, despite the proven safety and efficacy of vaccine, vaccine hesitance poses a significant threat to global health. So this presentation will basically address common concerns and misconceptions about vaccines. We can go to the other slide. Yeah, so understanding vaccine hesitance. Vaccine hesitance is a complex phenomenon influenced by various factors. And these are the major concerns. There are safety concerns. There is misinformation and conspiracy theories. There is lack of trust in healthcare systems and authorities. There is religious and philosophical beliefs, including cultural beliefs. And then there are social influences and peer pressure that are part of that leads to vaccine hesitance. So when we talk about, we'll tackle one by one, we'll look at vaccine safety. So the misconception in vaccine safety, we have misconception that vaccines are not safe and have dangerous side effects. And for our context here, this is something that is very common, especially in rural areas. But the reality is that vaccines undergo rigorous testing and safety protocols before approval. So serious side effects are extremely rare, and the benefits of vaccines outweigh the potential risks. Of course, there are some side effects, but we are saying the benefits outweigh the potential risks. Also, we are saying that vaccine safety is continuously monitored by WHO and other international and national regulatory bodies. So we are also looking at debunking the autism myth that has been ongoing, not only in South Sudan, but in countries like Uganda, Kenya, and other countries, that the MMR vaccine, the measles and mumps and rubella vaccine causes autism. But the reality is that this claim originated from a fraudulent study that has been retracted. Of course, when you go around, you see that this study has been retracted, and it has not been taken as a true study. So numerous large-scale studies have found out that there is no link between vaccine and autism, and therefore vaccine do not cause autism. So this is another myth that we need to debunk. You can move on. The other one is the other misconception is vaccines do not work and natural immunity is better. And the reality is vaccines are proven to be highly effective in preventing diseases and their complications. Of course, natural infections can be dangerous and lead to serious health problems, long-term disability, and even death. So vaccines offer safe and controlled way to build immunity without the risks associated with natural infection. And we know that herd immunity is achieved through high vaccination rates. Of course, when we have high vaccination rates, that's when we can have herd immunity. So that's another misconception that is around the communities. So we wanted also in this slide, we wanted to talk about the role of social media, especially in debunking some of these misconceptions. But however, we are saying this is a double-edged sword. It can be a powerful tool to spreading and combating vaccine misinformation, but as well as it can mislead. For example, I'll give an example of some case in Uganda when there was some polio vaccination. There were issues with some of the children who were vaccinated. It was all over the media and discouraging parents to have their children being immunized against polio. So this is the double-edged sword. It can mislead, and also it can be used to combat the misinformation. So social media can be used to disseminate accurate information, connect people with credible sources, and promote positive vaccination messages. Therefore, targeted intervention on different platforms can help reach specific audience and address their unique concerns. We can move on. There is the importance of trusted messengers, and these include healthcare providers. It includes community leaders. It includes religious leaders and social media influencers. These can play a key role in opening honest conversation, especially between parents, patients, and other community members in debunking some of this misinformation. For us in South Sudan context, this has been very, very key because, you know, most of the rural areas have no access to internet, have no access to media channels like radios and so on, and therefore the most reliable methods that we are using is using the trusted messengers, especially the community leaders and the religious leaders, including the health workers, to debunk some of these misconceptions. You can move on. So we have modifiable factors and strategies for improvement. One is focusing on modifiable factors is essential for improving vaccine rates. We have education intervention that can address knowledge gaps and correct misconceptions about vaccine safety and effectiveness. Of course, these can be targeted education intervention, can target health workers, can target key community leaders, can target politician can target actually even the media personalities, such that they understand and we address the knowledge gap, which is a key issue here. We also have strategies tailored to specific communities and cultural contexts. They are also very important in overcoming barriers to vaccination. Contextualizing this, countries like South Sudan, which have over 60 ethnic groups, and all these 60 ethnic groups have different beliefs and practices. It may be very, very important to have strategic, tailored, targeting communities and cultural, certain cultures, because all of them have different beliefs and different, and how they understand, and how their understanding towards the vaccination is. So it is very important to have these tailored and targeting specific communities. The last point here is addressing access issues, such as transport and cost, can make vaccination more convenient and equitable. Here, access is still very, very challenging, looking at climate change effects like floods and so on, loads being other facilities are not accessible, and so on. So increasing access is also very important. So conclusion here, vaccine resistance is a significant public health challenge, but it's not insurmountable. Addressing concerns, debunking myths, and promoting accurate information, we can use it to build vaccine confidence and protect individuals and community from preventable diseases. Everyone has a role to play. Individuals stay informed, ask questions, and make informed decisions. Healthcare providers, we are telling them to engage in open dialogue and address concerns and be a trusted source of information. For communities, they are supposed to promote accurate information, support vaccination efforts, and address barriers to access. Policymakers implement evidence-based policies and support vaccination programs and address systematic issues that have been long-living and affecting the communities. That's the end of our presentation, and thank you so much.
Thank you so much. Thank you so much, David. And I'm glad that you could pick that. This is the Q&A session, and we just have a few questions that are on the platform. I hope Dr. Bakunawa is still here. Sir, are you still available?
Yes, I am available, but maybe if you can also help read out the question if they are relevant.
Yes,
because
I want to just read it out. So I don't know, is either you or David or maybe Abdullahi, anyone, or the presenters, anyone that is available can help to answer the question. So I have one question. It says, how to reach, it's written in French and we just translated it in English. So he said, how to reach populations in rural areas. How do you reach populations in rural areas, knowing that they certainly do not have access to social networks and are likely a population at a very significant risk? So just asking maybe new strategies or certain strategies that have worked that you can use to get both, I'm looking at both the demand generation, information, health promotion activity, and also the vaccination itself. How to reach populations? So this is the first question. I don't know who wants to take it. And then the second question says, knowing that vaccination protects to a certain extent against serious forms of infection, populations are often more likely to take antibiotics when they think they can manage the problem themselves. Will less serious forms of infection not be a factor that promotes the misuse of antibiotics and as a result, a greater risk of resistance? I think Dr. Bakunawa is the one that will answer this question. So he's saying, okay, will less...
Yeah, so the last question, the question is not that very clear. Maybe you can.
Yes, I think it's
Seems
because
like
of the
use.
interpretation anyway. It says will.
Hello?
Sir, can you hear me?
Okay, so what do you say? You say
It says will less, like most people would definitely want to take antibiotics if they think that the infection is not very serious. So what I'm saying is taking that antibiotics, will it promote antibiotic resistance and all those things. So I think that's what the person says.
okay, yeah, thank you very much. So what we are saying is like one of the benefits of vaccination, we say that it will reduce the prevalence of the antibiotic resistance. We know that one of the major challenges that we have around management of cases like pneumonia in particular, usually a slight case of pneumonia, an incidence of, like, if there is a suspicion of this is a case of pneumonia, the first thing that usually people do is actually to get an antibiotic. And, by subjecting people to the frequent use of antibiotics, the chances of them not really to comply with the use of the antibiotic is there, which can also be a potential factor that can bring antibiotic resistance. So in terms of the role of vaccination in prevention of antibiotic resistance is for the fact that when somebody is vaccinated, so he's already protected. It's called primary protection. So that primary protection tends to prevent the individual from even acquiring the disease condition, talk less of even leading to the use of antibiotics, meaning vaccination protect individual from the disease. So by the time you are protected from the disease, of course, you'll be protected from the use of the any antibiotic, because it is only when you are ill that you also request the use of the antibiotic. So that is where it is. And when condition is not serious, people tend to use like antibiotic instead of this. So in fact, if they are well protected, they don't need they may not likely even come with the even not serious infection, talk less of using of the antibiotics. So those are some of the benefits
Vaccines.
of the vaccine. So tend to prevent infection, which reduce the use of antibiotic, which reduce chances of coming with antibiotic resistance. So the first question related to hard to reach areas. Yes, the strategy. So there are a lot of strategies that we can use. So for us, hard to reach areas are categorized into two. There are hard to reach areas that are as a result of physical structures or maybe distance. And those, they are riverine, mountainous, they are all hard to reach areas. We also have another category of hard to reach area, which is linked to security situation of a particular place. So there are a lot of strategies that we use. For security compromised areas, they are also hard to reach because they are difficult to reach because of security compromise. So in that situation, we deploy a strategy that we refer to as hit and run. What we mean by hit and run is to use security personnel in deploying the vaccination, meaning you plan the vaccination session with the use of security personnel. So there is what we call a strategy that we call RIC strategy or rest strategy. So the rest strategy is the reaching every child strategy. Reaching every settlement strategy, that's rest. We also have RIC. RIC is RIC, which is reaching inaccessible children. So the children that are deemed to be inaccessible because of either security are also reached the use of this hit and run. And that hit and run is just simply by deploying using the security personnel. That, or another way also, you can even give vaccine to the security personnel so that by the time they open a community, they can now deliver the vaccine to them. They have their health workforce. So those are the strategies for the security compromise. While the hard to reach areas, most of the hard to reach areas are also security compromised. So in that situation, if they are riverine, we use also boats in Nigeria. That is also what is applicable. Some that are very far or they have security compromise, you can also use choppers like helicopters to deliver the vaccine. You can also
Thank you
use
very much, sir.
yes, other source of transportation. So those are some of the strategies. Thank you, and over.
Thank you, sir. Thank you, sir. This is the first of 3 webinars, so it's not exhaustive. We still have the next webinar coming up in January, and then the last one that will come up sometime in March. So, and I would love for everyone to also come in and stay tuned to hear the unfolding. The next one will talk about vaccine financing and then how countries can raise domestic resource mobilization. You know, Dr. Bucknor said something, it's not just enough that you have brought in the vaccine. Also, it has to get to the last mile and get into the arms or into the mouths of the children that it's intended for. Also, we're also going to look at more work that the CSOs have done so far. So we'll spotlight Guinea by the next presentation, the next webinar, so that we'll look at, they will now have a proper presentation with pictures and everything on what they have done so far. So please, and I apologize for extending this for more than 13 minutes. Oh my God. And I would like to thank you all for being patient with us and staying all through to this moment. I hope you have registered your name in the attendance form, and thank you very much for, but please, and